And now, it's Boomer Life. Lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
I'm tired of waking up tired. Waking up tired. Yeah, waking up tired. I'm tired of waking up tired.
And welcome to Boomer Life on CL 650. We'll get to the waking up tired part in a moment, but a good segue into our show, Boomer Life. Today we're joined by the Snore dentist, Dr. Sharnell Muir. Welcome back.
Thank you, Zach.
And we're just a couple of weeks away now from Valentine's, and it's a romantic time of the year, but nothing says romance like a snoring partner, right?
Yeah, that can pretty well kill the romance for anyone.
So we're going to talk about the risks of somebody who snores and also affecting, romance, what have you. Welcome to the show, and you bought a bunch of goodies with you, and we're going to get in. I know it's radio, but we're going to talk through what you brought. But I think I have to give you accolades again, coming up with the name the Snore Dentist.
Thank you.
Because it's a great stroke of marketing, because you're kind of explaining what you do just in the sort of tagline there, Snore Dentist. So explain what a Snore Dentist does for people who maybe haven't put the dots together.
So my first degree was in dentistry, graduated 30 years ago from UBC, and then went on to do what's called a Diplomate in dental sleep medicine. So I am trained as a dentist, but my practice provides services that treat patients who have snoring and or sleep apnea with oral appliances. So I no longer do root canals and fillings and crowns and all those other good things. I don't have a hygienist or anything like that. I just have a practice that treats patients for their breathing at night.
Okay, so do you need to be a dentist to do this sort of thing? Or you have to be, right?
Yeah. So your first degree has to be in dentistry. And then you go on and do extra education and training on doing just the dental sleep medicine. And that's different than sleep medicine, which is a physician that specializes in sleep medicine. I'm a dentist that limits my practice just to dental sleep medicine.
And because you're putting appliance in someone's mouth that is attaching to their teeth, kind of like a night guard or a retainer, right?
That's right. So it fits onto the teeth. They're custom made. We take specialized impressions and bite registrations and that. And those are different than the hockey mouth guards people wear, or night guards they might wear for grinding that their general dentist would give them, or retainers they would wear after braces. These are a specialized appliance that have a degree or a component in which they help the airway stay open.
So I'm sure there are people listening to this right now who snore, or being told they snore, or they live with somebody who does snore. And are most people coming to you initially because of the noise and the aggravation of having a snoring partner, or is it because of airway breathing problems?
Right. So about half of my patients come to my practice mainly because snoring is disruptive at home. So either it's disrupting someone to the point where they are told, basically, get something done, or they have been told in the past, and maybe they're entering a new relationship, or they want to travel with people or visit kids over Christmas, anything like that. So disruptive snoring can be a leading cause for about half of my patients to come in. The other half come in either because they're tired, or they're sent from their physician, or they're sent because they have tried a different therapy and it's not worked for them. So about half and half. Yeah. Now, most of my patients will have some degree of snoring.
Right.
So the most patients who have any degree of what's called sleep disrupted breathing or a sleep disordered breathing will have a degree of snoring. Some don't, though. Especially my women. About 20% of women will come in with fatigue without snoring. Yeah. So they'll express their tiredness more like a depression versus thinking they're not breathing at night. Whereas the guys, it's normal for guys to snore, so that's kind of expected. And the biggest issue is that snoring is so common, it's really become almost normal for us to think about, but it's not normal at all.
So even though the majority of people, okay, let's ask you, you're the snore dentist, how common is snoring?
Common, yeah.
So then, so you're saying that anybody that snores is at risk of having a breathing problem at night?
Yes. Yeah.
No matter.
Now, there could be snoring. Say people have situational snoring. Say they only snore when they have a cold. Well, that's to be expected. You know, you're plugged up and air's not moving very well, so you might snore during that. Or maybe you only snore if you've had some alcohol in the evening. Well, that would be expected, you know. But for those that become habitual snorers, there's a high likelihood that they're also not getting enough air.
And so the people that maybe are listening to this and are just not feeling themselves, it could be because...
It could be.
So what's the recommendation? Go and speak to your physician first or come and see you because it could just be an air breathing problem at night.
Right. So absolutely come in and talk to me and find out if I can help you. So there are monitors we can send home with you to figure out whether your snoring is limiting your airflow, whether it's in certain positions, whether it's affecting your heart rate or your oxygen or anything like that. So it's, you know, in order to treat someone for even what we call just snoring, then patients do have to have that diagnostic of just primary snoring.
You brought the kit
I brought
with
a
you,
gear.
so pull it out and let's have a look at it.
Yeah.
And you keep on pressuring me to get this done because apparently I snore.
Well,
I've never heard it myself.
you do, or at least you've been told you do. So the home sleep monitor, I'm going to try and describe it to the listeners. If they're able to go on the website and watch the video, they'll certainly see it as well. But the monitor itself is a simple 3-part device. It's simple to wear. You wear it at home. It's not the sexiest and most glamorous thing to wear, but it gets the job done. So the main part of the monitor is a small 2 by 3 inch square monitor that operates 2 batteries in it that we put in for you. And the monitor itself stores all the data. And this monitor itself is on a stretchy belt that you're going to wear around your chest. So you're going to strap it around to your rib cage, right? And you do the Velcro belt up and it stays nice and firm around your rib cage so that at night you don't have it twisting and turning and moving while you're sleeping if you do go side to side.
Would not, they wear brassieres, so this is not that different.
We're used to wearing elastics around us,
so
right?
men is a bit different.
Now, I always recommend that the monitor chest belt is worn over a T-shirt.
Over a T-shirt.
Over a T-shirt. Now, it will work. It will work on wearing it on bare skin.
Yeah.
But it's a Velcro belt.
So it's more comfortable.
And it's more comfortable over a T-shirt. And over a regular T-shirt, it's not going to affect the results at all.
Now, I have had the 24-hour blood pressure cuff. Have you ever had that where you have to sleep with the blood pressure cuff? I'm sure a lot of people have had that test.
And it inflates every once in a while.
And you're in the middle of the night, it starts going. That's not going to happen
here. This doesn't do anything like that. It just sits there.
Okay.
Right? So it's not...
So that goes around your chest, your rib cage, and it's monitoring what?
So what this does is it collects the data in the machine part, but the actual belt that's around your rib cage right now has a small gauge on it, and it measures rib cage
pressure,
expansion. So every time you go to breathe, your rib cage expands and then it contracts, and this picks up how many times you're taking a breath in the night and your rib cage expanding. So that's what that is measuring, is your rib cage expanding when you go to breathe, and how many times.
We're speaking with Dr. Sharnell Muir, the Snore dentist, about snoring, finding out just if you're a snorer or you have some form of sleep apnea or what do you call it?
Sleep disordered breathing is the category.
Breathing. So we're going through the kit that you give to patients to take home. So the first part is the belt that goes around your rib cage. It's got the monitor in there, and then the elastic band measures your chest going in and out when you breathe. So what other parts are there?
So there's 2 other parts. The finger probe, which a lot of people will have experience with if they've been to a hospital.
So that's something that monitors your oxygen level?
Right. This is going to measure...
That doesn't feel like anything,
No. So it's going to measure oxygen and heart rate. And it's basically a red fiber optic light that reads through your nail bed, and it picks up the level of oxygen that you're carrying in your blood as well as your heart rate. It's easy to wear. I always recommend you wear it on your non-dominant hand.
Okay.
Because if you want to get up at night and answer the phone or help the kids if they need to go back to bed or go to the bathroom, you're going to want that dominant hand, and I don't want my machine anywhere near some of that stuff. So any of the three fingers on the non-dominant hand. And we do also recommend that you secure it with a little bit of medical tape that we put in the kit for you. Just secure it to the back of your hand or around your finger, just so that if you do toss and turn a bit at night, it stays in place.
And anything else?
And then the last part is the nasal cannula. So this, for a lot of people, would look similar to an oxygen tube.
That you see people wear in hospital,
that's right.
in the movies too.
That's right. So it's not blowing oxygen. It's just going to sit there. So It's got the two little prongs that fit into your nose, and then you just loop it around your ears and do it up under your chin, and it just records airflow as it's moving through your nose.
So the combination of how often you're breathing, how much airflow is going through your nose, and then how much oxygen is in your blood tells you what?
Tells us whether or not you have an obstruction or limitation in the airway that's causing a problem.
So if you're trying to breathe in and you're not getting the air in, the belt will say, okay, I'm trying to breathe in.
But I have no airflow.
No airflow, and then a slight delay, and it shows the lack of oxygen.
That's right. So what we look for is a lack of airflow for 10 seconds or more. And then we look for a drop in oxygen levels of 3% or more.
Okay, now, what about people? Does it show how restless you are through the night as well? Like, will you see a pattern? You're in a position, you're not getting the airflow, you keep waking up because your brain says, I need to breathe. And so you've come out, you don't really get into deep sleep. You kind of wake up a bit, you shift around. Does it pick that up too?
Yeah, so it's got an accelerometer in it, in the monitor itself, on the chest belt that goes around your rib cage. In that machine, it's going to tell me what position your chest cavity is in.
Side sleeper.
So side sleep, right, left. It'll show me back sleeping, prone sleeping, and upright. So sleeping on your back, sleeping on your tummy, right, left, or up. So it will tell me what position you're in and how often you change positions. And so you can see very restless people at night. So
you see people that move all night long.
Yes.
And you see a correlation between the not breathing, the oxygen level.
Yes. Now, we do also ask patients to keep a sleep diary. So in the morning, just let me know how your night was. Let me know whether you were aware of getting up and doing anything at night. So at 2 a.m., I got up to go to the bathroom. At 5 a.m., I let the cat out, whatever those were. But also, we ask patients to rate their night. Was that about an average night for you? And we'll often get, I kind of was... Maybe I think I didn't sleep very well because I was aware of the monitor.
Well, I could imagine it takes a little longer to get to sleep to start with.
Yeah.
Right. So maybe the idea is to get into bed a little early with it and maybe watch some TV or read a book just to forget that it's there.
That's right. Some people will put it on and not turn it on until it's time to actually go to sleep. And they'll read a book, or they'll watch a little TV with it on, or they'll practice with it before it's bedtime. Absolutely. But for those that are tired, it doesn't really matter. They'll fall asleep with it anyway. The ones that say, I sleep really well at night, they don't even know it's there. For some patients that have insomnia, it does give them something else to focus on, and it can be a little troublesome for them. And sometimes we will do a second night for them, but we can always repeat the study if we don't get enough data.
Okay, when we come back, we're going to get into the devices, and we'll get into how this is analyzed as well. When we come back, we're speaking with Dr. Sharnell Muir, the Snore dentist. Is also a sleep better, live better, which is a great tagline as well. But Snore dentist, I think, is just killer. It's easy to remember.
It is.
And the website is?
snoredentist.ca.
See, there you go. Perfect. We'll come back with more right here on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.